The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Today on Meet the Doctor, I am honored to introduce Carrie Houssock from the beautiful city of Baltimore.
Yeah. Call it Baltimore County. Sure,
Maryland.
Beautiful.
Welcome to the podcast. It's good to have you here.
Thank you so much for having me.
Now, you're a plastic surgeon. Tell us a little bit about yourself.
I'm a plastic and reconstructive surgeon. I am 100% aesthetics at this stage in my career. And I originally am from a small town in Pennsylvania and then found myself in Philadelphia for medical school and had originally thought I would be a general surgeon. And then kind of, like a lot of people do just in general with careers, discovered that I really had a knack for the artistic side of aesthetics and plastic surgery. And then was lucky enough to match in residency at Hopkins, which is how I am here today in Baltimore. So I just, life-changing training in the city and met a really fantastic mentor who I ended up joining in practice privately in a private practice right out of residency and ended up buying from him after he transitioned into retirement. So that's where I am today in my own private practice here in Baltimore County. It's a single solo practice and medical aesthetics kind of spa, medi-spa. That's what we do here.
And is it just you or do you have other providers on your team?
I have myself. I'm the only surgeon in the practice currently. And then I have a mid-level nurse practitioner who does a significant amount of our non-surgical treatments in the medical spa. And then we have a nurse injector as well. So for the most part, it's the three of us and a couple of estheticians.
An all-female practice too?
It is all female except for a one token nurse. We have a male nurse who runs my hair restoration practice. And, you have to be a certain kind of individual to be able to handle the amount of females that are in this amazing group. And he's like our brother, it's really, really great. And he definitely brings, a necessary part of life to an all-female practice for sure.
Yeah, I bet he's a good counterbalance. And that hair restoration part of your practice, I believe that was something you also inherited from your predecessor. Is that right?
It was. And so it's so interesting because even though hair restoration is a huge part of plastic surgery and reconstruction, it's not a huge part of education. At least it wasn't during my residency. And so I discovered it when I met Dr. Vogel. And Dr. Vogel had been one of the premier hair restoration specialists in the nation and really in the world. He's one of the founders. He was a past president, what's considered the ISHRS, which is the International Society of Hair Restoration. And so I really spent the first 2 years out of residency working here in the practice, but also almost as an additional mentorship, learning how to do hair restoration. So I really did inherit not only the practice, but really a specialty, I would say.
Do you see a lot of women for hair restoration too now?
I do. And I think that's probably the biggest transition to the hair restoration that we do at the practice now that it's me, is that, of course, we see a lot of males. And generally speaking, hair restoration is thought about in the male realm. But there is a huge population of females who suffer from hair thinning and hair loss. And it's just really not talked about. And in some ways, it's more traumatic and dramatic for women to lose their hair. But we all, at some stage in our life, are most commonly, we do it, we talk about it in pregnancy, we talk about it through menopause, but we don't really talk about how to manage it. And so in our practice, and it may very well be, no coincidence that because I'm a female, we do see a significant amount of female patients as well.
What kinds of weird things do you hear women who are losing their hair are doing to kind of hide it or camouflage it or cover it up before they realize that there's treatment for that?
I mean, the typical is our hair pieces and a lot of scarves. And so women will come in really good at camouflaging and have been doing it sometimes for decades and didn't even know that they had options. And they'll walk into our practice, and sometimes you don't even know, you can't even notice that they have an issue until you get them in that room where they're more comfortable to show you their loss. There's so much out there that is also kind of hoped to work, whether it be supplementation or sprays you can use and all of that. And it's great as a potential help, but none of it really is going to fix the problem. And again, I think a lot of women who come into our practice just don't know that they have options.
They don't. So, what does actually fix it?
So it depends, right? So hair is so much more complex for the female population than it is for males. That's number one. And that's probably not a surprise. We're just a little bit more complex of beings in general. So our hair loss is complex like that too. And the big way that it is complex is how it's in a way multifactorial. So men in general, they have thinning from something called androgenic alopecia. It has to do with testosterone and dihydrotestosterone. And lucky for females, yeah, we get that too. But we also see a lot more effect from hormones. So our hormone changes. For instance, like we do talk about with pregnancy and during premenopausal and during menopause, we're affected by that hormone change. And that is not something that men have to deal with. We also have a higher risk of what's called telogen effluvium, which is like a shock loss from stress. So whether it's a physical stress, being sick, or mental stress. So it's a very long answer to say that women have treatments, but it is very much based on what would be the causes in this particular patient. And then based on that, a multifactorial treatment in order to compound it. And the good news is that if they are treated appropriately, a lot of females can see even better effect of their treatment than men. It just has to be diagnosed appropriately.
Is it right? The way that I'm thinking about it is sort of like it's you realize it's starting or it's happening to you, and your first instinct is, I need to stop this from getting worse. And then later on, there's sort of a, how can I get my hair back? Is that normal?
Yes, absolutely. So I think when someone comes to see a hair restoration specialist, their thought is right away just surgery. Like, I want to have hair. I just want to get hair back. But you're absolutely right in the sense that just like any other portion of medicine, there's the preventative portion of cessation, stopping the loss, slowing down the loss. And then once it's under control and stabilized and maybe even improved medically, then we can dive into that surgical realm. My fear is that if a patient is not treated in that medical way first, and you do not have that cessation, or at least discover why they're losing, if you proceed to transplant, number one, the transplant may not even take depending on their disease process. And number two, it may be successful, but they'll continue to lose. And so there's no question there's a medical side to this, even though I'm ultimately a surgeon.
And do you offer people the whole range of treatment, no matter where they are? You're not sending them away.
We absolutely do. So we start very much with the medical portion of it. And depending on the patient and their loss and how serious it is and how stable they are when they meet us, we oftentimes will put them on medications first and then see them back in a few months to make sure that they've stabilized. There are disease processes that I think are beyond my specialty. And so in those instances, I will refer them to some of my dermatology colleagues. And those instances are things that are more autoimmune based, and things called something like a scarring alopecia, where they need a better control of that medical portion before they can dive in with me. And so we'll determine that at a consultation. And if I do think that they need that, I will refer them.
You just hit on another thing that everybody doesn't know, which is that dermatologists can treat hair loss and also nails. Like, people just completely forget that derm is hair, nails, and skin.
Absolutely. And we get a lot of referrals from dermatology. We work hand in hand. And so there are things that I can't provide that they are much highly specialized, much more than I am, and vice versa. When it gets to a surgical point in someone's treatment, then they refer to us. So certainly, I think I would never say that we would be interchangeable. I think we work in synergy.
Mm-hmm. Well said. Yeah. So hair is an unusual specialty among plastic to begin with. It's not ordinary for everyone to do hair. So that's special for you too, also as a female surgeon. What other kinds of patients are you seeing alongside hair? I know most surgeons will lean toward face or lean toward body. We know you can do everything, but what else are you focused on?
Yeah. So before I answer that, just something about hair, which always shocked me, is what you just said, which is that plastics is not typically considered when you think about hair restoration. But when you think about the aesthetics of the face and you ignore hair, it's almost like it just makes zero sense. But you're right. We just kind of blow it off. But when we think about the aesthetics of the face, the hairline and the hair is just as important as, say, the nose or the chin or the cheeks, which we consider so important for the face. So I think that's fascinating. And I'm not quite sure, and I can't even really dive into why that is. But you're right. It's kind of like a forgotten item. And the only reason I think it's really important to just kind of focus on that for a second is because one of the populations that I think have the biggest effect on their results for hair restoration is my transgender population. And that population, you can imagine that a male type hairline, which is that, typical M shape with temples exposed, can be very dysphoric for a transgender patient who is really in their best way trying to be their best self. And so a transgender female can struggle a lot until that hairline has been softened and feminized. And that's when I really noticed how important the hairline is to the aesthetics of the face. So just wanted to mention that because I think it's really important.
That's a really good call out. I think over the years, we've also started to see the techniques from facial feminization surgery apply to female facial surgery.
Yeah.
Is that a fair statement too?
Yes, I think so. I think it's, we learn from each other, right? So it's kind of all intertwined. And I think sometimes in a moment we are so focused, like there are times in aesthetics where everyone's focusing, for instance, the buccal fat was such a big thing and everybody's talking about buccal fat, and it's like we've always had this, why is this all of a sudden a thing? But sometimes it just opens up other discussions, right, and other things that we notice, and now we focus on it. We were talking about the jawline forever, and I think all of a sudden now you don't hear jawline as much as you used to. So some of it has to do with just what's popular at the moment, maybe.
Social media and celebrities certainly have an impact. And I think also the more hidden impact comes from industry. So when you have, just thinking about hair again, we had Bosley for our entire lives, pushing from the television side. So we don't maybe just inherently think that plastic surgeons do hair restoration because that's how we were trained to think about it.
Yeah. Yeah. And so Bosley, for
Or
instance.
hair club for men.
Right. But all of those people are doctors, right? They
Sure.
are. They just, for whatever reason, it is a lot of family medicine doctors, some dermatologists, but it's a surgery ultimately. And you're right that even in the realm of ISHRS, that big group, it's the only group in the world that right now, there's not an American Society of Hair Restoration. I wish there was, but there's not one yet. It's not a lot of plastic surgeons. I don't know if we just kind of like, oh, we got bigger fish to fry.
Mm-hmm.
But it's such an important part of aesthetics. So that is about a third of my practice. The other 2/3 is really about non-surgical facial and then breast and body surgery. So I am all over the body, but I do specialize specifically. I do a lot of breast and body surgery. It's probably my biggest passion besides the hair restoration portion of my practice. I would say the vast majority of my patient population are moms and weight loss patients. Those are two big populations within my breast and body practice.
They both need a lot of help.
Yeah, and they need a lot of support, and it's not just physical support. They're patients who are coming to you very vulnerable and self-conscious, and I think it's an honor to be their surgeon, but it's also, to me, it's my job to create an environment where they can feel comfortable. They have to feel comfortable talking about things that they are most insecure about. And I think we take that for granted every day that we are plastic surgeons, if you don't consider it, that someone is walking into your practice and they're bearing their self in a way that they may not even bear themselves to their family members. And if you can't respect that and just be completely humbled by that, then I think we're missing our calling.
In what ways have you built an environment in your practice to protect people who are coming to you in that state?
So we as a practice, meaning the people that I have in my practice, we make sure that everyone who works within the realm of meeting you from the minute you walk in the door to taking you back to preparing you for surgery has compassion for what you're there for. And that means that we are non-discriminatory. We have regular discussions and meetings about making patients feel comfortable. And I know this sounds crazy, but I genuinely don't have to worry about it, because if you were to meet the staff members in my practice, I don't know how I got this lucky, but we have created this group of individuals who absolutely, and I really don't understand it, love coming to work. And all I can tell you is that when I bought the practice, I wanted to love coming to work. So we've created an environment that I enjoy coming to work. And because of that, the staff that we have here melds. And I've had patients tell us this time and time again, that they can feel that. So if you walk into a environment and you're nervous, but you feel everyone around you is at ease and they're comfortable in their environment, it brings you there. And I think that's how we do it from the minute you walk in the door.
What other kinds of things do patients say to you about their experience coming to see you?
They always tell me about my staff. So for instance, after surgery, I call my patients the night after surgery. Every patient gets a phone call to check in. And I am telling you that it is almost universal that the first thing I'm told when they answer the phone is how lovely my staff was to them today. And it's interesting because you're under anesthesia, right? So what you remember is, limited.
Not much.
But from the minute they walk in the door, they are put in a nice, soft, cozy robe like they're at a spa. They're placed under a warm blanket. They're placed in a room. It's not cold like a typical hospital bed surgery center. It's comfortable. The lights are set up in a way that makes you feel a little bit at ease. And so I think they remember that portion. And then my recovery nurse, for instance, we call her a real life Disney princess. She has the most lovely, soft voice. She's so pleasant and she's doting. And even if they may not remember, because sometimes they don't even remember her specifically, they remember how they feel, I think. And I think that means everything, because you could have a surgery anywhere. To be honest with you, you want to find the right surgeon, yes. And you can have the operation as long as it's sterile and clean, you could have it anywhere. But there's something to be said for an environment, especially when it's a choice. Like in this world that I practice in, this is a choice that every single patient's making. I'm not doing their gallbladder. This is something that they have chosen, and an environment, I think, is everything.
It is. There's some research, it's not that old actually, around why, because patients can't determine quality from your credentials, like they actually don't have the knowledge or the skill or the information they need to judge your credentials at all or your skill. They don't know they can't do that. They substitute with things that they can judge. I know this both from surveying and from the paper I'm thinking of. And so they will hang on to things like the office was a mess, and then they'll translate that to surgical quality, which is totally unfair. But that's all they have.
But is it unfair? I remember we talked about this in general surgery even. You would do a liver surgery, and that patient would have a huge operation. And I remember a surgeon, and I wish I could remember who it was, who is probably when I started getting interested in plastic surgery, was so meticulous about their closure, and not only the closure, but the dressing. And I remember them saying, the only thing the patient can see is this dressing. So this has to be perfect, because it doesn't matter how good we did inside. If this is a mess, they're going to assume that inside was as well. So it's our job to make sure that we, from start to finish, make sure that it is that environment for them. It's not just about the OR. I do think that there's this old school mentality of surgeons could come into the room and be rude, and doesn't matter because they're really good. So it's okay because they're really good. But I think that we're kind of going beyond that now. I think patients are getting smarter. And I do agree that it is still very complicated when you're looking at credentials. It's getting even more complicated now. more than ever before. So you're right. We have to figure that out. But I don't know. I think some of it does translate as well. Some of that simple stuff does translate.
I know that you survey all your patients. This is also, I know because I ran the survey company that you use for 5 years. Every patient gets a survey and you don't cherry pick whether they do or don't receive a survey. And sometimes their feedback might not necessarily be what you want to hear. But the only way we know how patients are feeling or what their experience was like is to ask. And I remembered why I was thinking about that. The key driver of choosing a surgeon is that actually surgeon made me feel comfortable. It wasn't surgeon was triple board certified. So
Interesting. Yeah.
being comfortable is both environmental and personal. And those things all combine together. There's some things we can overlook if all the other things are great, but there is a tipping point where too many things didn't go the right way. And that's how we lose people. So anyway, I love the data. I love asking people.
I love data too.
It's easier to ask than guess how they felt.
Absolutely. And sometimes, I mean, we're all clouded by our own thoughts and judgments too. So you can't really know how someone is feeling. That's you're not in their shoes, even though you try. And I'm a little bit lucky in the sense that I'm a female, and the vast majority, I would say, of at least my non-hair population is female. So I can relate in that way. I'm a mother, so my body has changed like a lot of my patients have. So there is some of that where you can be in their shoes, but you're still not in their shoes. And so knowing how what their real opinions are, I find it very valuable. I love feedback.
Tell me about your kids.
I have one and only one. I say my patients are the rest of my kids. Mm-hmm. I'm a late bloomer. I had my son is 21 months now. So I had him just before I turned 40. And I wasn't planning on having children. I was just going to be a professional. I spent my whole life pretty much to get to this moment with you, Ava. Really, I spent a lot of my life to train and prepare to be a plastic surgeon. So it wasn't really in my radar to be a mom, but I met my husband and he wanted to be a father and I knew he would be a really good one. So we had our little boy, and it's amazing how you don't know what you don't have until you have it. He's the most special thing in the whole wide world. I would have never known what I was missing, but
no,
pretty
they're
exciting.
The most interesting people I know.
They are. It's fascinating. You can be a scientist. I've been a scientist. I've through undergrad, medical school, residency, training, and understand the body. And it is still so fascinating to me to have watched what my body could do and then to watch my son's brain develop. Like, it's just shocking. It's just unbelievable.
I remember thinking I was going to have to teach them everything. And it was so shocking to me that they just learned stuff on their own.
Yeah. All of a sudden, like just doing stuff. It's just... I literally still think that someone else must be teaching him. Like, I'm like, someone must have taught him that at daycare because how did he know how to do that?
It is the best.
The best. I mean, and he's all, really in my life. It's my patients and I go home and it's family. There's very little, and you figure it out, but there's really not a whole lot of me time. There's that limited amount that I do. I try to do it in the morning to have my own workout time, and then the rest of my life is my son and my patients. And I just would have never known. I would have never known that kind of love.
I think one of the best things about being 40 when you're doing it is that you're not missing out on anything.
No.
Like, you don't feel like you're tearing yourself away from like some grand social life to have children.
Not at all.
That's what happens when you're in your 20s. Your life ends.
Yeah, apparently. Now, I guess, I don't know what social life, I guess, was really ever like, because in your 20s, you're in med school, and then in your 30s, you're in residency. But I would say, yes, I had a lot of fun. And my husband and I talk about that a lot, that we were already at a stage in our life where we were slowing down. And so it was kind of a grateful thing almost. Like, I have now an excuse for not going out. Like, it's, Caleb's bedtime. It's where I would have preferred it.
So... is there anything else aside from your son that you like to do away from the office?
Yeah. So my only other real love besides my husband and my son is I love the Peloton. That thing is a game changer. And it's not just getting on the bike. Like, I love working out. I've always loved working out. I remember when I graduated from college, they said, your workout life is over. I was a college cheerleader. Said, you're going to medical school. You'll never work out. And throughout my entire training, I always just made sure that I had that time. And it's not rocket science. Literally, you need to have that mental break. I mean, it made me successful to have that. So I still do that to this day. And these days it's the Peloton, but it's just the whole, do you do it at all? Have you done the Peloton?
I haven't. I was a spinner for many years. So I get the allure of it. I totally can get inside of it, but I'm in the laundry room right now, Dr. Houssock. There is no room for a Peloton in this house.
I mean, you make it happen wherever you can, right? It's crazy. But even just like, I just think that they're just so smart. And I'm barely even on the bike anymore. They have classes for, I love working, like lifting weights. So they have lifting weight classes. They have walking classes, whatever. It's such a genius thing because for a mom who doesn't have a lot of free time, I would love to go to a physical gym, but I can't. So it's so nice to get up at 5 a.m. And when I try at least to get up at 5 a.m. Those days of like not needing sleep are over. But before my son wakes up, I get up and I get that time to myself. And I think it just literally makes me a better person. It makes me a better mom and it makes me a better surgeon if I take that little bit of time in the morning to do that for myself. So I almost feel like it's not negotiable. It's not really a vice. It's like a necessity.
Oh, yeah. This episode is brought to you by Peloton.
Yeah. I wish.
No, we are not sponsored by Peloton. Use promo code EVA for, yeah.
Maybe we could get like a shout out on one of the rides or something. I don't know.
And we'll try. Never say never. Before we go, curious if there's anything on the horizon for you that you're looking forward to either at work or somewhere else that's coming in the future.
Yeah, I think growth is good, right? So it's scary, but it's good. I think this practice has room for another practitioner at least. And I haven't found them yet, but because I am so dedicated surgically to breast and body and then this niche of hair restoration, we do facial and I do facial surgery, but I would love to have a partner in crime eventually. So that's on the horizon for me when I find the right person, but they have to fit our vibe. And our vibe here is one of that I'm so, so very proud of. And so I'll be picky about it. But that would be our next big step in this, in our world here. And I'm hoping in the next couple of years to find that right person.
I look forward to seeing who that person turns out to be. Thank you for joining us today. If someone's listening and they want to reach out, find out more about you, where would you point them to do that?
So I do the vast majority of my meeting my patients before they even arrive on social media. So I have an Instagram page. It's Dr. Carrie Houssock. So Dr. Carrie Houssock. I'm on there as raw as I can be. So you see my son, you see my family, you see my surgeries, you see me. I don't plan it. It is very off the cuff and I like it that way. And my patients seem to like it that way. So follow me if you really want to know the real me. That's probably the best place to follow along.
I will put that link in the show notes. Make it easy to find.
Thank you so much, Ava.
Thank you. It was so good to have you today.
Such a pleasure.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.